Good day to you all. I would like to present to you my project title, Leading the Way, Girl Advocates for Health. My name is Anuradha Rose, and I work in the Christian Medical College, Velo. I'm a professor of community health, and I also head the Department of Bioethics. So I put up two pictures, which I think best describes me, and because most of my work is in a tribal community, and both these pictures have been taken in the tribal community in areas which I love to work in, that is mainly with children and with socioeconomic development, a lot of which is with livestock and agriculture. So this area which I work in itself is about 70 kilometers from Vellore. It's part of the Eastern Ghats and it's called the Jawadhi Hills. It's inhabited by a tribal population of about 60,000 people. And these are some pictures from there. And like most tribal population, because they live in a reserve forest, they are marginalized geographically, financially, and culturally. And access to education, livelihood, and healthcare is actually inadequate compared to the rest of Tamil Nadu, making them vulnerable. The children and women living here are especially vulnerable due to disempowerment and poverty. And like in most other places across India, men are prioritized over women, especially girl children, women and children, especially girl children, especially when it comes to healthcare and education. And as a consequence of this, people actually reach hospital quite late. Even when they have treatable diseases, they come with the complications. So my project actually is in working with the 100 girls from these tribal villages. This tribal region itself, in the two districts we work, has about 400 villages, and out of which we are working with we work with all 400 villages. In this particular project, I want to work with 50 villages where we have evening study centers or after school centers. And I plan to in my project, I have selected 100 girls, two from each villages. The girls are between the ages of 12 years and 16 years. And what I plan to do in this project is to make them advocates for health. So the 50 night schools have 50 teachers, and in my project, I have trained these 50 teachers in the life course illnesses in a woman's life, and so they are taught about what is important for prevention of diseases and promotion of good health. In the four, I've divided the life course illnesses into four areas: infancy and early childhood, adolescence and young adulthood, middle ages and the older age group. So the night school teachers have been trained, and they in turn teach the students whom they work with in these 50 schools. So that is just the short-term goal, but short-term objectives. But my overall goal is actually to empower this community by empowering these young girls who will later be young women in their villages. And I want to empower them to be spokespersons and advocates for themselves and to become leaders of change for the future. So the indicators and objectives I have right now are quite shorter, but my overall goal, which I hope to evaluate later and present to the WomenLift group maybe a few years down the line, is to empower this community by empowering girls. So my objectives are to train 100 girls to be advocates for health and health seeking, to make healthcare more accessible to the women by making these girls advocates for health. So what have I reached up to now? I have been able to raise funds for this program. I have finished 4 training programs for the teachers, who in turn have done 8 training programs for the girls. And referral books have been printed and distributed to the girls, and they are supposed to refer patients or women and men from their community using these books to the hospital, the base hospital, which we run in the tribal region. And the child who refers the most number of children will get a prize at the end of the year. So up to now, the referrals have only started in the last 2 months. We've had 16 referrals so far. And the impact, as I said, is in empowering the community, and that will only be evaluated much later. So my dream for the future for this community is to have a community where the health indicators and development indicators are on par with the rest of Tamil Nadu, and to have a community where women have a voice in their households and their communities. They have choices and they are in charge of their own lives. So the leadership journey which I have undertaken and had the privilege to be part of has actually helped me, and I hope that it has a sort of a cascade effect where the skills I'm learning in my journey, I'll be able to translate to the night school teachers, who in turn will translate it to the young children and as they transition into young women in their community. So thank you for your time, and good day to you all.